erection doesn't happen to a particular race, ethnicity, country, color, or whatsoever. It can happen to any man, anywhere, at any time. So it is not something that happens to this particular people or this particular people or this particular men. No, weak erection can happen to anybody. Now, what exactly is erection and how does weak erection occur? Erection is that process during which blood rushes into the penis, making it firm and strong. Now, weak erection is when this process is interrupted. I'm going to say it again, all right? Erection is a process during sexual acts, during sexual intercourse, whereby sexual arousal, whereby blood rushes into the penis, making it firm and strong. Now, weak erection is when there is interruption of that firmness, interruption of that blood flow to the penis. And when there is interruption of that blood flow to the penis cannot sustain that firmness. It cannot sustain that erection. That is what is called weak erection. Now, what can lead to this weak erection? Does it just happen to anybody? Does it just come on its own? No. There must be an underlying factor. Something leads to weak erection. And one of them is physical factors. Physical factors such as diabetes, obesity, high blood pressure. These are morbidities, these are medical conditions, these are physiological factors that can make one to have weak erection. Now there are some drugs that are used to treat these conditions I just mentioned that can cause weak erection. So if you're experiencing weak erection while you are being treated of hypertension, check with your healthcare provider what those drugs are, their side effects, so you rule out those drugs from the cause of your weak erection. Okay, so there are some, like I said earlier, these drugs can impact negatively on your sexual drive and your sexual health. So you have to discuss with your healthcare provider. He or she looks into the drugs being prescribed and know exactly the one to remove and the one to replace so that your erection can be sustained. All right. So if you're having these conditions, if you're having these mobilities and you experience weak erection, be calm. First of all, get to your healthcare provider and see what can be done. Another factor is psychological factors like stress, anxiety. Some men are too anxious. Some men are too anxious during sexual intercourse. So you have to calm yourself down and put yourself together. That anxiety makes the blood to just relapse, they just go back. And sometimes it doesn't even flow as it should because the body is not relaxed. The body just wants to do sharp, 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 and then that's it. So if you're having weak erection, look at your anxiety level, look at your stress level, look at your coordination. All right, look at the way your body coordinates during sexual intercourse. How do I behave? How do I take things? How do I walk myself through the sexual heart, through the intercourse? How do I go through it? So these psychological factors, sometimes emotional trauma, when one is stressed emotionally or have had bad sexual experiences like rape, abuse, sexual abuse, it tends to, impact negatively on the psychological aspect of that individual. If your partner has experienced a rough ride with his sexual health, you have to look into that, and you also have to get in touch with your counselor. You have to get in touch with your psychotherapist, so that he or she can walk you through that process of emotional healing, because it's definitely going to impact on your sexual health and you end up having weak erection. So you work on your anxiety level, you work on your stress level, you work on your emotional state during sexual intercourse. Okay, now what are your lifestyle choices? How do you live your life? What kind of lifestyle do you live? Are you a smoking addict? Do you smoke excessively? Do you drink excessively? Do you abuse drugs? So how do you live? What kind of drinks do you take? Now, smoking to you might just smoke and that's it, but there are toxins in the cigarettes that can impact on your sexual health, like lead. Yes, lead has a way of intoxicating. Lead has a way of shifting your sexual health, altering and damaging so many things in your body that impact negatively on your sexual health. So if you are an addict, if you are a smoker, you may need to also get help. Yes, you need to first of all get help, and you also need to accept that you have a problem with this. So the first step is when you have to treat your lifestyle is admitting that you are the problem here. You are, because it's start from you accepting and getting help. If you do not accept that there is a problem with your lifestyle, with the way you are living, with the things you put into your mouth, with the things you inhale, then you may not really get help. You may end up just wallowing in self-pity, wallowing in low self-esteem of weak erection. And I know you wouldn't want that, right? And that is why you're watching this video, to actually get help. So you need to modify your lifestyle. You need to walk yourself through that hospital, through those sessions of psychotherapy, through those sessions of behavioral therapy, cognitive therapy, so that you'll be able to put yourself together and live a good life, live a well preserved life that can enhance your sexual health. Like I said earlier, medications, some medications used in treatment of some underlying diseases or illnesses can impact on your sexual health. So after prescription, and you notice that for some time you'll be taking a particular drug, and you notice that during sexual intercourse you're no longer at that height, at that climax you used to be, you may need to return back to your healthcare provider and lay this complaint. I am not getting what I used to get before. Don't be shy. Just open up and speak up, okay? So that these drugs will be looked into and probably changed for you. And to all my beautiful ladies out there watching this video, I I beg of you, I encourage us to be supportive. Yes, it may not be easy having a man who has this problem, who experiences weak erection. It is not also easy on them. Every man wants to perform. Yeah, everyone wants to outdo. Everyone wants to give his wife, his partner, this experience, this um experience of ecstasy. But when it doesn't happen, it is our duty. It is your duty. It is my duty also. for those of for those that are married, yeah, it is your duty to actually be a shoulder for him to lean on, to be an emotional booster. I will always say them in my videos, be an emotional booster to your man, yes. So if he's experiencing weak erection, encourage him to go to the hospital. Encourage him. You can even go with him, yes. You can even go with him. So he feels like you also understanding what he's going through, you're not understanding what is happening to him. Okay, don't leave him all by himself to sort it out, and don't body shame, don't talk down on them, don't cajole them into anything. They need your attention, they need your support. Okay, so if your man is experiencing weak erection, look into his lifestyle, look into the medications he's taking. Is he having any underlying disease? What kind of drug does he take? What kind of nutrient is he taking? His food. You look into all these things, and both of you will achieve a very good, pleasurable sexual life. All right, so I hope you've learned something today. I hope you've gathered something today. Thank you for your time, for watching this video, and until next time, bye.